In a landscape where patient confidentiality is paramount, the minimum necessary principle stands as a critical safeguard established by the HIPAA privacy rule. This principle plots a path that restricts access and disclosure of protected health information, PHI, to only what is essential for achieving a designated purpose. By embracing this principle, covered entities weave a protective layer around patients' sensitive data, thereby minimizing the risk of unauthorized exposure and maintaining trust in healthcare systems. The minimum necessary principle and its relation to HIPAA privacy rule. In order to ensure the privacy and security of patients' protected health information, PHI, the Health Insurance Portability and Accountability Act, HIPAA privacy rule, establishes various safeguards. 1. Such safeguard is the minimum necessary principle. It requires covered entities to limit the use, disclosure, and requests of PHI to only the minimum necessary information required to accomplish the intended purpose. This tutorial will provide a comprehensive overview of the minimum necessary principle and its relationship to the HIPAA privacy rule. 1. Understanding the minimum necessary principle. The minimum necessary principle aims to restrict unnecessary access and disclosure of patients' PHI. By implementing this principle, covered entities can protect patients' privacy and reduce the risk of unauthorized access or use of their sensitive information. Scope of the minimum necessary principle. The minimum necessary principle applies to all uses and disclosures of PHI, except in certain situations such as disclosures to or requests by healthcare providers for treatment purposes. It also applies to both internal and external entities that handle PHI, including healthcare providers, health plans, and healthcare clearinghouses. Implementing the minimum necessary principle. To comply with the minimum necessary principle, covered entities should adopt the following practices. A. Evaluating and assessing. Conduct a thorough evaluation of the organization's practices and documentation to identify areas where the minimum necessary standard can be applied. B. Job roles and access. Assign job roles and access levels to employees based on their specific duties and responsibilities. This ensures that employees only have access to the PHI necessary to perform their job functions. Policies and procedures. Develop policies and procedures that clearly define the minimum necessary standard and provide guidelines for handling and disclosing PHI appropriately. Training and education. Provide regular training and education to employees on the minimum necessary principle and the importance of safeguarding patients' PHI. Technological controls. Implement technical controls, such as access controls and audit logs, to prevent unauthorized access to PHI and monitor its use within the organization. Exceptions to the minimum necessary principle. While the minimum necessary principle is a fundamental aspect of the HIPAA privacy rule, there are a few exceptions to its application. These exceptions include A. Disclosures to the patient. Covered entities are not required to apply the minimum necessary standard when disclosing PHI directly to the patient. Patients have the right to access their complete medical records. B. Disclosures to healthcare providers for treatment. The minimum necessary principle does not restrict disclosures of PHI to healthcare providers involved in the treatment of the patients. Disclosures required by law. Covered entities may disclose PHI as required by law, which may include sharing information with law enforcement agencies or reporting certain public health issues. Maintaining compliance. To maintain compliance with the minimum necessary principle, covered entities should regularly review and update their policies and procedures. This includes conducting periodic assessments of access levels, reviewing and revising internal controls, and technological tools, such as robust access controls and surveillance logs. Act as vigilant sentinels, ensuring untouched pathways to PHI remain sealed against unauthorized access. Ultimately, for every rule there exist exceptions. The minimum necessary principle does not apply in scenarios where information is disclosed directly to patients, allowing them complete access to their medical records. Furthermore, the rule provides leeway for disclosures to healthcare providers involved in direct patient treatment, prioritizing care above restrictive protocols. Therefore, The implementation of the minimum necessary principle not only champions patient confidentiality, but harmonizes it with the operational needs of healthcare providers. In a world increasingly reliant on data, this principle evolves as both a bulwark of privacy and a beacon of responsible health information management, ensuring that patients feel secure in sharing their most sensitive details.